erectile dysfunction or sexual weakness. Erectile dysfunction, ED, thus is the inability of a man to achieve or maintain an erection sufficient for his sexual needs or the needs of his partner. Erectile dysfunction may sometimes be even termed as impotence. The term erectile dysfunction can mean the inability to achieve erection, an inconsistent ability to do so, or the ability to achieve only brief erections. Age is a risk factor for erectile dysfunction. Many studies have shown that it is much more likely in a 60-year-old as compared with a 40-year-old man. Men who lead less healthy lifestyles, eat a less healthy diet, drink more and exercise less are also more prone to suffer from this. Physical exercise tends to lessen the risk of impotence. Erectile dysfunction, ED, is treatable at any age. There are now successful treatments for this disorder which ensures that most men with the problem return to normal sexual activity. Causes and symptoms of sexual weakness or erectile dysfunction. Causes of sexual weakness. Old age. As men age, there is a natural slowing down of many bodily functions. From a sexual viewpoint, this may occur as decreased firmness of erections, shorter lasting erections or a longer recovery time in between erections. These changes may be caused by a decreased production of testosterone, decreased blood flow or other diseases that are more common in men as they age. Most commonly, the sexual changes associated with old age are due to a combination of the factors discussed in more detail below. Decreased blood flow. A decrease in the blood flow to the penis will affect the quality of erections. The erections will be weak and or short-lasting. Diabetes. Diabetes can interfere with erections in a number of ways, and erectile problems tend to get worse the longer a man has diabetes. Half of all men with diabetes experience some degree of erectile dysfunction. Diabetes can affect the sending and receiving of nerve impulses. This condition is called peripheral neuropathy and may also affect the hands and feet of diabetics. Without good nerve function, erections are more difficult to achieve. Diabetes may affect the blood flow to the penis. Men with diabetes often experience decreased quality or number of erections. Healthy blood vessels are needed for the engorgement of penile tissue that leads to erection. High blood pressure, hypertension. Hypertension can affect erections either by the changes it causes in the blood vessels, or by the medications used for treatment. Hypertension may affect the veins, allowing the blood that does rush into the penis to exit just as quickly. The effects of hypertension on erectile function are cumulative over time and may occur even before a man knows he has hypertension. Pelvic surgery, prostate, bladder, rectal. When surgery is performed in the pelvic area, injury to the nerves and or blood vessels may result. Even with nerve-sparing procedures, the nerves may be temporarily or permanently altered. With extensive surgery for bladder or rectal cancers, a large amount of tissue is removed and impotence may occur. Spinal cord injury, multiple sclerosis, and other nervous system disorders. An injury to the spinal cord disrupts the nerve pathways necessary for an erection. Sometimes men with a spinal cord injury may get reflex erections. However, these are unpredictable and usually very short-lasting. Multiple sclerosis interferes with the nerve impulses in the body. Also, multiple sclerosis may lead to generalized weakness and immobility which make it difficult to get an erection. Any other disorder which interferes with the nervous system can make good erections difficult or impossible. Hormonal problems. The hormones play an important part in sexual function. They are responsible for the sex drive, also called libido. Hormonal imbalances such as low testosterone or high prolactin can disrupt the libido. Depression and psychological problems. Depression may lead to erectile dysfunction by a loss of sex drive, or by the medications used for treatment. Problems with premature ejaculation and the anxiety associated with it may lead to erectile problems. Cigarette smoking, excessive use of alcohol, drug abuse. Habits such as smoking, heavy alcohol use and recreational drug abuse may inhibit erectile function. The effects may be temporary or permanent. Temporary erectile dysfunction may occur as a result of ingestion of large amounts of alcohol. Permanent effects may occur from the effects of smoking on the blood vessels or alcohol on the nerves. Substances added to recreational drugs may damage both the vessels and nerves. Medications used to treat a variety of diseases can affect erectile functioning. Some of the more common are drugs used to treat high blood pressure and depression. Switching medications may help restore sexual function. Changes in medication must always be ordered and supervised by a medical professional. Talk to your medical doctor about the possibility of switching blood pressure medications. There are many medications for hypertension which do not cause erection problems. Peyronie's disease is a bending of the erect penis which is often painful. The exact cause of Peyronie's is not known, but there may be some association with trauma. This condition can lead to impotence and/or inability to have intercourse due to the curvature. Herbal remedies for sexual weakness or erectile dysfunction. Erectile dysfunction, ED, is a condition that many men will end up suffering from at some period in their life. While ED may be a sign of a more serious complication such as diabetes or heart disease and warrants a visit to your physician, sometimes, especially in younger men, it may be something simple that triggers it. Stress, cigarettes and excessive drinking, alcohol, have all been known to trigger ED. While pharmaceutical giants have tackled the problem of ED and have come up with extremely popular drugs such as Viagra, Cialis, and Levitra, there are many herbal and natural remedies out there that a man can use to treat his problem. However, if deciding to use a herbal remedy, be sure to still consult your doctor before doing so. While something might be derived from nature, it still could interact in a bad way with any prescription medications that you happen to be taking. Double-checking with your healthcare professional and reading all the information on the label of what it is that you are taking is always a good idea. There are a number of different herbal remedies out there that claim to improve the condition of erectile dysfunction. In order to understand how these natural remedies work, it is important to understand how an erection is achieved in the first place. The first step is sensory stimulation, tactile or imagery, of the brain. Once the brain is stimulated, it sends signals down to the nervous system setting things in motion. The nerves surrounding the penis are vital in maintaining an erection. If they are not working properly, the achieving and maintaining an erection becomes a difficult task. Once the nerves are stimulated, then the circulatory system kicks in, sending blood flowing into the shaft, causing it to become engorged and erect. As men age, the circulatory system does not function as properly as it once did, resulting in poor blood flow to the penis. All three of these stages of arousal can be enhanced with herbal and natural remedies. Natural remedies that promote a state of relaxation can help men who suffer from erectile dysfunction. How to cope with an impotent husband. Erectile dysfunction is a physical inability to keep the penis firm during sexual intercourse. Impotence, on the other hand, describes not only the physical problem but also encompasses a broader meaning which includes a mental lack of desire. Both conditions can happen for several reasons. But whatever the cause, a man's partner suffers just as much as he does from his condition. Luckily, there are several ways to deal with an impotent husband. Instructions reassure him. Your husband is just as frustrated as you are with his problem, if not more so. He needs your love, your support, and your understanding right now. Whatever you do, don't start blaming him or yourself. Talk to each other. Make sure you have thought carefully about how you feel, and open up the conversation at an appropriate time. He may be uncomfortable or even defensive at first, but by opening the lines of communication, you may both discover that talking helps a great deal. Make an appointment with a doctor. A man suffering from impotence may actually have a serious health problem like diabetes or depression. Even if neither of you thinks this is the case, he needs to see a doctor to make sure he isn't really sick. Seek counseling. Remember, coping with impotence doesn't mean you simply have to resign yourself to a non-sexual relationship. If you and your husband have tried to resolve the issue on your own and nothing works, then getting some professional guidance may be the answer. Take action. Instead of sitting around wishing your husband could perform, Help him by being supportive and try to make an appointment with a doctor.